Hey, how's it going? Welcome to another video, another content topic. I am a pediatric nurse practitioner. My name is Kelsey, and I would like to talk about allergen introductions for babies. So the American Academy of Pediatrics and the CDC says for allergens such as eggs, soy, nuts, and whatnot, that it's actually beneficial to introduce these earlier as opposed to later. This is new guidance. When we look back to 20, 30 years ago, that wasn't the case. There was an influx of peanut allergies. So now we see the data shows that when we actually introduce earlier, there's a better outcome with and less incidence of allergies to peanut butter. So really interesting. So now current guidance says when you do allergen introductions, you can start at 6 months of age when a baby is ready to be able to eat solids, being able to sit upright, head control, and all that good stuff. So introduce allergens right away. I have this product that I'm using with Sunny, which is really great. I have an 8-month-old son, and we're using the Lil Mixin's box. So this is a kit that comes with a few common allergens. We have eggs, peanuts, cashew, walnut, tree nut, sesame, soy, no tree nut, but there's walnut, cashew, almond, peanut, sesame, soy, and eggs. So that's really great. These are common allergens. Another one would be like shellfish. So this kit is really cool because it's all powdered. You can mix it into baby food. So let's say you don't want to start right away. You do a few weeks of starting foods. You introduce your little one to pureed food, some vegetables, some fruits, rice cereal, oatmeal, whatever it may be. And then you're ready to start introducing allergens. This kit is really awesome. So you open the kit up and you have all these individual powders. I would not go by what they say, which is like every day you give a new one. Don't do that. AAP and CDC guidance says you introduce each new allergen for 3 to 5 days in a row because you want to see if there's an allergic response. You want to actually see if there was any kind of skin reaction or the most severe kind of reaction, like an anaphylactic, a full body response. If you're giving your baby multiple new foods at once, you're not going to know what it is. So it's important that you err on the side of caution, go slow. It's not a race to introduce all these things all at once. You can do it over time. You have to be comfortable. You have to feel confident and comfortable in doing this because the whole food introduction experience, everything with food for your little one, it has to be low pressure. They have to feel low pressure, low anxiety. It has to be fun and a positive experience. So no need to rush into it and overthink it. I think a kit like this makes it very low effort in having to prepare and stuff like that. I myself, as a new mom, a new parent, was thinking about, am I going to be able to do this? Because I feel like I struggle as an adult preparing, meal prepping and cooking, and I struggle with doing all of that. And I felt overwhelmed actually myself. And I was like, how am I going to do this with baby food? But what I wanted to do, I'm able to do it. And I told myself, I'm going to make this low effort. We're not going to overthink it. And we're going to use the available tools. I don't want to use processed foods. I don't want to use jarred foods. I want to make my own baby food. And I've been able to do it. I discovered that it's pretty basic and simple. Any vegetable I'm preparing, pretty much like you're boiling or steaming it for 15 to 20 minutes. And then I either blend it or mash it and I'm good to go. So I make my own baby food. I like to give Sunny a lot of oatmeal. And what I do with a lot of these allergens, because they kind of go like the peanut and almond, they go nicely with oatmeal. So I just mix it in. So he'll have the allergen exposure and then he'll also have delicious oatmeal that he likes. So this kit is really cool. The Lil Mixin kit that has all of these. And it's when you look at the nutrition information, each item, it's simply just that ingredient. For peanut, it says organic peanut powder. For eggs, denatured egg powder. organic cashew powder, and so on. So this is a really great source, great tool. I like to recommend this to a lot of my patients, and even better that I'm currently using it and I vibe it out. It comes with a lot. For each one, it comes with 4 packets. Do you need to use the whole packet? It's like 6 grams. The whole packet, do you need to use it each time? No. I feel like use it as your own discretion. As long as you're giving enough of the food group, it is going to be enough for an immune response, for the body to take it in and all that. So I'm gonna go through this box. I'll probably have a lot of left over. And then what I can do is make a nice little enrichment pack powder. I can combine it all together, all the nuts all together with oatmeal, and give him a very enriched oatmeal for the future. But for now, I'm doing them one by one, and that's what I would recommend for my parents. I would go by guidance. I would recommend what guidance says. I know there are so many food programs like baby led weaning, and there's just so many food philosophies, and I think take a little bit from everything. And also what my training tells me is you have to make the food experience, it cannot be stressful. You don't have all these expectations because your brand new baby who has never tried any food in their whole life is just experiencing this food for the first time. They're experiencing moving their mouth in that way for the first time. Their tongue is a brand new muscle that only knows how to move in certain ways. And food introduction is also the experience for learning how to move those muscles and coordinate and all that. So in the first year of life, our food that we give our little ones is not meant for them to have nutrition. I see all the time on social media and online forums, like for parents, where people share these big plates that they're giving their little ones, and they eat them and they're doing great. And then there's parents who are just so disappointed, or they're so flabbergasted that their baby is not eating this whole plate. And that's not the point at all of giving your baby food. It's not the point. It's for the sensory experience. They have to learn how to use their muscles. They have to figure that out. It should be playful and fun, and it's always a good experience. Also, with the water that comes into play with food, when they're drinking water, ideally from an open cup or a straw, that would be my recommendation for right away. You give them an open cup or straw to learn how to move their mouth around the straw and form around a cup. So it's all this experience for your little one. It should be very low pressure, and it should be a fun experience. They will learn eventually how to eat, and then by the time they're 1, that's when we transition to a more nutrition is from food versus from formula or breast milk. So I just want to emphasize that, because I feel that there's so many parents that they're so concerned that their baby doesn't eat a certain amount or a certain thing, a certain texture. And we have to just remember that these babies, they're brand new. They're learning as they go. So obviously there's that learning curve. Of course, the reason why you have so many primary care visits for your pediatrician, for your pediatric provider, is because the assessment of normal development is also done. Obviously, there's normal, and then there's concern for being evaluated in the sense of speech evaluation, feeding evaluation, stuff like that. So there's always that possibility for checking. There is a true instance of concern with how your little one is eating and so forth. But I want to just reiterate, it's normal for babies to not finish all the food they're presented. It's normal for them to cough and gag a little bit, catch their breath, because it's all a brand new experience. Going slow and being patient, and the consistency in the food introduction is really key. And then when it comes to allergens, it is totally okay and safe to start earlier, to start at 6 months of age. And the guidance says for 3 to 5 days in a row of one allergen at a time. And what you could do is have Benadryl on hand and ask your provider for the safe dosing to have on hand of Benadryl if you were worried about a reaction and whatnot. But guidance says it's okay to do that at home. If your little one is allergy prone or if they have eczema, if they have mild eczema, it is still recommended to do it at home with good contact with your pediatrician and all that good stuff. If they have moderate eczema, then the guidance says you would want to probably check in with your pediatrician and maybe even trial nearby and so forth. But you do it at your own discretion. And again, you're going to have your conversation with your pediatric provider. I'm just speaking on what guidance says and all that good stuff. As a mom, as a new parent myself, it's been an interesting experience and very lovely. I am very proud of Sunny. He has now tried eggs, soy, peanut, almond, and we're working our way through the rest, and he's loved it. He's liked the taste. He likes certain textures, other textures he's not really too fond of. But that is something I realize it's a happy coincidence because different textures, it's important for a baby to be exposed to different textures of their soft foods that they are trying. And when you are boiling or steaming a vegetable, it's actually perfect because there's different textures that come about when you're just mashing a sweet potato versus a carrot, right? So some maybe more fibrous, different textures like an avocado mashed, and you can play around with the consistency. But it gave Sunny that variability, so I thought that was really cool. It was a happy coincidence that he was able to have the difference in textures and that he can experience that. So that's my little spiel about allergen introductions with babies. Here is the key with allergens in babies is just go slow, follow guidance, days at minimum, 3 days in a row of an allergen, and then you can move on to the next one. Make the food experience low pressure. It should be fun, chill, and consistent. It's not about the nutritional value, it is about the sensory experience with your little one. So that is all I have. I would love to hear any experience or any questions. I want to hear from you parents. Please, I'd love to open up this conversation, talk more about food and allergies and whatever it may be related to food and babies. And let me know if you didn't realize that babies don't have to have this big portion and they don't have to finish their plates that you present to them. Let me know your thoughts on that, how you feel. I think it's just such a wonderful experience, and being a mom myself, it's such a wonderful experience showing Sunny different foods, always just sitting down every day with him. It's so incredible and so cool to see him kind of understand and get the concept and learn more and more every day. It's just so cool to see him do that. And I started with a straw and open cup right away, and over time with the consistency he's been doing really awesome. So I'd love to hear from the community, and please share your thoughts and comments. So I will leave on that note. Once again, I am Kelsey. I'm a pediatric nurse practitioner. I love to share parenting things that come up in practice and with myself. So I will sign off on that note. Thank you so much for listening and have a good day. Bye.